Hi, this is Dr. Marty Klein. Today I want to talk about desire. Desire for what? One thing is consistent in my therapy practice year after year, and that is I'm always seeing a lot of couples who are in conflict about each other's sexual desire. Last year, for example, I saw many couples in which one partner was upset at the other for not wanting sex enough. Apparently, some people expect that expressing their anger will motivate their mate to want more sex. Then they're surprised when their anger results in less sex rather than more sex. Some of the lower desire partners were on the fence, possibly open to more sex under the right conditions, but their partner's periodic anger simply never allowed those conditions to emerge. In other cases, the lower desire partner used the higher desire partner's anger as the perfect excuse. See, what do you expect? Who could have sex with a person who's always criticizing? You might be surprised at the number of people who ignore their partner's emotional needs for days or weeks or all the time, and then they approach that person for sex, who typically declines. Many of these decliners seem to me like they really do want sex, and they're regretful or they're frustrated when they say no. Their partner frequently thinks, well, they're just not sexy or they just have a low libido. The person who's chasing is surprised when I go out on a limb and I say, actually, I think your partner really wants sex, but they need more non-sexual attention or emotional connection in order to accept sexual invitations. It's true that some people, more or less independent of circumstances, are horny and want frequent sex. Other people, they need to feel connected first. Neither version of sexuality is better than the other, but when you put one of each two of those two types together, you have the equivalent of a mixed marriage. Each one tries to convince the other that their way is better, and no one ever succeeds at doing that. In my experience, people who want affection or connection before sex are not going to change that. Anyone who's waiting around for a partner to change this is going to be frustrated. In my clinical experience, on the other hand, people who don't need such a connection, they can learn to enjoy creating it with someone. Then they get more sex as a bonus. When these cases resolve successfully, which is not always true, that's how it typically works. Desire also raises the question of the quality of the sex that people think is available. Although Lenny Bruce famously said that most men are so generically horny they'll do it with mud if they have to, most men and women want more than that from sex. Even if someone doesn't crave emotional connection as part of sex, most people who desire sex want something more than simple passivity in a partner, or a partner who won't look at them or kiss them during sex. Many lower desire people complain that when they do agree to sex, their partner charges ahead full speed. These lower desire people often say they feel that their partner is having sex with their body, but not with them. They say things like, if he were actually connected with me during sex, he wouldn't go so fast. He wouldn't get so far ahead of me. When I talk about desire in my 2012 book, Sexual Intelligence, I ask, desire for what? Again, some people desire just sex, and if there's no deal breaker around, such as somebody has a cold or they're in the middle of a fight or whatever, they're in the mood easily and quickly, regardless of the kind of experience that they actually expect that they're going to have. On the other hand, many people say that if the sex that is available is with someone who doesn't bathe very much, or kisses too roughly, or is impatient or easily annoyed, their desire is low. While some, including their partners, call such people low desire, I generally don't, unless, of course, they expect that every sexual experience will be unpleasant, regardless of circumstances. Some people have inhibited desire because they're anxious about performing. They may believe that if they can't deliver lubrication or erection on demand, their partner will be upset and they'll be embarrassed. In fact, many people of all genders and orientations are concerned that if they don't have an orgasm, their partner will interpret this as a criticism or reflecting their lack of attraction. Some women go even further than that. They feel insulted if their partner doesn't climax inside their vagina. These desire cases may be slightly easier to resolve because frequently there's desire there. It's just being constricted by anxiety. Of course, not all anxiety can resolve easily. Some people require medication. Now, the medication is often successful, but ironically, chemically, it can inhibit libido or arousal, and so there may not be any net gain. And some people are anxious as a response to trauma, which can be famously difficult to resolve. Dividing people into two categories, high desire and low desire, is way too simplistic. Therapists and physicians do this and shouldn't. In fact, most people do it, describing themselves or their partner as low desire or high desire. I'm not so comfortable with that wording. If I have to use something, I prefer higher desire and lower desire. When comparing or contrasting a pair of sexual partners, we should be categorizing other dimensions as well, such as higher connection, lower connection, or higher gentleness, lower gentleness. Of course, that would acknowledge that things are more complicated than we wish they were. Finally, I want to say a word about people who need frequent sex. Sorry, nobody needs frequent sex. Now, some people want frequent sex, and I have no quarrel with that. But when people tell themselves or other people the story that, I need frequent sex, and if I don't have frequent sex, I can't be a good partner, I can't be a good parent, I can't be a good worker, that's problematic. Besides, very few people want to be the remedy for that kind of sexual need, basically being the medicine that their partner requires in order to be a responsible grown-up. So what might lie behind the story that someone believes that they need frequent sex? It could be that they want continuing reassurance that they're desired or loved. It could be that they get anxious when they feel separate from the other person and that sex makes them feel connected, reducing their anxiety. It could be that they fear their partner's abandonment and they like the reassurance of frequent sex. People express a wide range of unconscious emotional needs using a sexual vocabulary. Helping people work through why frequent sex is so important to them often reduces the urgency of their drive. This can lead to their partner being more interested in sex, thus connecting the two partners in ways that weren't available before. Contrasting sexual desire between partners is famously difficult for all therapists, including me, to resolve, particularly if we don't believe in that model of, well, just close your eyes and lay on your back and do your duty, right? But with careful evaluation, we can identify the cases that are more likely to respond to treatment and choose treatment strategies that can actually help. It's crucial for professionals to see beyond the simplistic idea that we simply need to increase the low desire partner's libido. And couples need that broader perspective too. Well, thanks for joining me. I'm Dr. Marty Klein.